Long before modern medicine, pain was part of the cure. Ancient healers turned to fire, not as a weapon, but as a tool of healing. This was cauterization, the brutal practice of burning wounds closed, a line between survival and suffering drawn in flame. In a world without anesthesia, without germ theory, fire promised control over blood and rot. Its logic was elemental. Heat seals, heat purifies, heat endures. But the price was agony. This is the anatomy of the past, the torture of healing, where courage, desperation, and fire met at the wound. In this film, we trace its origins, its method, its science, and its legacy, a journey through brutal ancient medicine and the flame that still burns in modern surgery, from fire to precision, and everything in between. To begin, we return to the first embers of medical history, where healers learned that sometimes to save a life, you have to burn, and that dot of light carried across empires. Records from Egypt, Greece, and Rome reveal early surgeons using heated bronze and iron to stop bleeding or destroy infections. To them, fire was purification. Pain was the price of survival. In Egypt, temple healers and practical physicians blended ritual with remedy. Greek text kata-kato-te tektiaru-telog, cogged irons for vessels, for flesh, for fistula, tools tailored to wounds. Roman Medici brought fire to the battlefield, trading speed for survival. Papyrus scrolls, Hippocratic treatises, and later Galenic summaries preserve the method and its cautions. Fire symbolized cleansing, a visible force against invisible corruption. In a pre-germ world, heat made sense. It changed what people could see. Blood staunched, rot cauterized. Practice evolved, but the principle persisted across centuries and borders. Communities accepted pain as medicine because choices were scarce. A hiss meant heat enough to seal a vessel and keep life within. Herbs dulled edges, wine offered courage, but no true anesthesia. Knowledge traveled with traders and armies, so did the flame. As metallurgy advanced, cautery grew more precise and more common. Now, witness how it worked. First, the fire. Charcoal stoked, iron buried until it glowed, dull red to bright. Without anesthesia, the patient was restrained for safety, not cruelty. A bowl for cooling, oil for control, and steady hands for the seconds that mattered. The iron rose, bright as decision. The body braced for a necessary storm. Without anesthesia, the patient would scream as the searing heat sealed the flesh. The smell of burning skin filled the air, but bleeding stopped, and infection for a time was held at bay. Seconds only. Too long scorched, too short, blood returned. After, herbs soothed, bindings protected, and prayer or patience did the rest. The tool slept in water, the wound in bandage. Relief was not comfort. It was the absence of worse. Heat denatured proteins, sealed vessels, and formed a barrier against entry. Some cleansed tools in flame, not knowing they fought microbes they could not see. For the healer, timing and nerve were the craft. But what did the fire truly do, and what did it destroy? Cauterization worked in its own horrific way. The heat sterilized and sealed, yet it also destroyed tissue and sometimes caused deadly shock. Seal the vessel, stop the bleed, a trait of damage for survival. Fire killed pathogens but invited scar and stiffness. Shock could fell the strongest, pain could undo the cure. Too much heat scorched beyond need, too little failed the purpose. Healers countered with herbs, honey's antiseptic myth and merit, and time. Recovery measured in weeks, not days. They knew it hurt. Many hated it. But what else stopped a torrent of blood? On battlefields and in homes, the choice was warmth of fire or cold of death. Texts cautioned restraint. Try ligature, try pressure. Burn, if you must. Over time, string joined flame. Later, knowledge would outshine both. Every scar marked a bargain with fire. And yet, the principle endured. Control the bleed, control the threat. From crude rods to instruments of precision, the flame kept evolving. Today's surgeons still cauterize, but with precision lasers and sterile instruments, what began as torture evolved into a cornerstone of modern medicine. Electric current, radio frequency, laser, heat woven from physics, not coal. Now the burn is measured in microns, guided by light, cleaned by science. The shapes differ, the intention echoes. Control replaces guessing, precision replaces brute endurance, fire to photon, brazier to calibration. Germ theory reframed the enemy, and asepsis changed the battlefield. From fire to science, the flame of healing still burns. We inherit both the brilliance and the burden of the past. Every precise spark remembers the first flame. The torture of healing became the technology of care. This has been a study of cauterization, its pain, its purpose, its legacy. If this history moved you, join us for more anatomy of the past. Until the next chapter, keep a cautious respect for the flame.